Hi, Tom. How are you?
I wasn't able to unmute. Now I'm allowed. Hi, Bogdan.
Hi. I would like to just say that I am here. Okay, Tom. Thank you.
And then, what, are you going to run away now? Are you going to leave?
I'm sorry?
Are you leaving?
No, not yet. No, not. Okay.
I see you there. You're on the list.
Okay, I'm going to call Arthur right now. Okay, Tom? Thank you.
All right, bye.
Thank you.
Hello there. How you doing?
Hi, Jess. How are you?
Thank God I'm well. Thank God. How are you?
I'm here.
Clifford Miller. He'll speak on the ED renovations. Tanya Desbrodis. She will speak on the COVID testing and the vaccination.
Tanya, what? Tanya with an O, Tanya with an A, Tanya with a...
Tanya D-E-S-G-R-E Desbrodis. T-E-S Desbrodis. Desbrodis. Let me look at her email. I'll tell you right.
Look up her name and get it right.
We are going to have also, okay, so I could spell this one for you.
No. Let's do one at a time. Come on, don't make me crazy.
Hold on, let's go into the email.
Or you can email me later with their right names and titles. So when I,
Okay.
Erin Drinkwater can tell you how to do that. She always sends me all the right names and titles from all the people from DHS.
Okay, so I'll send it to you.
But for now, so this Tanya.
If you say it Degro, it's said Degro, but it's spelled Desgrotes.
Okay. I got it. And then, so she's about the COVID testing or vaccine
And vaccination. And we have Ms. Lisa Scott, our COO. She's currently online right now. Lisa Scott.
Hi, good evening, everyone.
Hi.
And Dr. Lilu just popped on. He is mental health. Dr. Lilu's in charge of mental health.
Okay. Yeah, I don't know where my committee is. It's Erin and Bogdan and myself. I don't know where everybody else is. Marie, I got only one. Marie, are you there? Yes, Marie?
Yes, I'm here.
Yeah, I only got one like excuse person, Tish, because Guido broke his hip.
Oh boy. Lisa just joined in. Lisa Belmonte.
Oh, good. I see her. Yeah, Tish's daughter, Dina, sent me an email on Sunday that Guido had broken his hip and was getting surgery. And Tish's 90th birthday is August 30th, so
Wow.
if you want to throw a party, let me know. Hi, Officer Molina. Hi, Captain Faye.
Hi.
Captain Vasquez had a death in the family, so he's not coming.
Cliff Miller logged in.
Mitch Miller?
Cliff Miller. He's the one that's going to
Oh.
speak on the ED expansion.
Sorry, I dated myself with like Mitch Miller. All right, so nobody gets sick tonight because half the hospital is here.
Yes, I'm mute. Yes, we warn everyone. Everyone stay healthy. Till tomorrow.
All right. 1 minute.
You couldn't see me?
I couldn't see you. I don't know why. Now I can. You have to monitor 12,000 windows. You know
In
all
about
about
a
that.
minute, they're not going to see me because I'm going to go off camera.
Well, no, as long as your name's there, I know you're there. Because
I'm
that's how
here.
we
I'm here.
keep track of you.
I'm here. Hello, everyone.
I'm signed in as my husband again. I have a problem. I'm using his device, so that's me.
Okay, so that you're signing in
Andrew.
as your husband again. Is it so
Yeah.
his name is again Gaminsky?
No, it's Andrew. I will tell him. I will tell him what you said.
Hi, Jessica. Jessica from Woodhull. I saw you there.
Hi, Maria. We miss you over here.
You really don't. You don't want me.
I see you more than in the cab, than when you were on the cab.
This is true. For good reasons.
All right, so we've got 1, 2, 3, 4, 5, 6, 7, 8. Okay. So who is Roger with the hospital, or is who's Roger with?
Hi, Tom. It's Roger. No. I was in the meeting 2 weeks ago.
That's right. He's a public member. That's right. He's a public member guy. That's right.
How are you, Tom? Good evening.
There he is with a star next to his name. Okay. I can't keep track. This is Marie. When are we going to go back to in person? Huh?
You
Oh,
asking me?
after July 4th. Hello to Cliff Miller, also from Woodhull. Oh, you got all your peeps up in here, Jessica.
Hi, did you see the list of? Yeah, it's Woodhull Hospital night. Because we don't have anybody going to the cab anymore, so we have to bring them to us.
Muhammad,
Maria, you've got Lisa Scott is on and Dr. Lilu. I don't know if you got to meet Tanya DeGrotis. She's ambulatory.
No.
Hello, good evening, everyone.
Huh.
Hi, Maria.
Hey, how are you?
Good. How are you? We miss you.
Miss you too. You guys don't want me. I just told Jessica.
Oh, well, listen, I heard you say you were hanging out with Jessica aside from the cab, so.
Welcome. Happy to see you. Happy to see you doing well.
Thank you. Always
All
happy
right,
to see you as well.
1, 2, 3, 4, 5, 6, 7, 8. There's 9 of us of the committee here, so we might as well get on with the show. If that's all right with everybody. Anybody know anybody who's showing up late or trying to get their way in or anything? Okay. So I invited Jessica Orocho, who's the community affairs party person at Woodhull. And I had a bunch of things. We haven't had updates on anything for a while because we lost our wonderful cab member, and no one has raised their hand to volunteer to be the cab member to replace her. So Woodhull may not be located in Board 1, but it is our hospital, and so we figured we should know what's happening. I had done a list of things which was on the agenda. It's just from what I knew was going on over there, the emergency department getting expanded. There has been some discussion about the women's pavilion. People have asked about psychiatric services in the community, and what's happening with the pandemic. So, Jessica, I'm going to turn it over to you to coordinate your team. You can introduce yourself and, whatever.
Hi, everyone. I'm Jessica Arocho. I'm the Director of Community Affairs at Wilhelm Hospital. I am the liaison between the hospital and the community. So what that means is that I go out to the community, I find out what the community needs are. And if they say we need more mammograms or we need better machinery, I bring that back to the hospital. I also I bring from the hospital, I let community know what the hospital has, what services we provide. So I am that middle person, that liaison. Today we have our COO, Miss Lisa Scott McKenzie. She's over there. Say hello, Lisa. And we have Dr. Lilu, who's the Chief of Psychiatry, right? Is that the correct?
No, I'm the Associate Executive Director. We have a
Okay.
chief, but that's okay.
Okay, sorry.
Rojo.
We have Tanya DeGrotis. Tanya DeGrotis is in charge of ambulatory care. Cliff Miller, he is in charge of our ED area. And that's basically it. I don't know if you want to go by the order. You have things.
Well, Jess, you
Yes.
might want to talk about some community activities that have occurred lately and what's coming up. And then if you've got flyers and stuff, you're going to send them to us to put with our report.
Yes.
Especially that special event we just had recently.
I want to begin by thanking you, Tom. Thank you so much. We had a great time. I had a great time, and then I had the best hangout partner, Tom. Tom was there in support of us at Woodhull. So we had our COVID event. So it was the 1-year anniversary, and I was so glad that community board came out, which was Tom came out in representation of community board 1, and he got to witness some of the magic that takes place here. And so we did that event. We did it was a little a procession. And we had the fire department play some instruments and stuff. We had a performance, a flag dance. We had someone sing. We let go of some biodegradable doves. It was an amazing day and experience. I mean, folks cried, folks laughed. We had some elected officials come out as well. And it was I thought it was a lovely event, but Tom could let you know if he enjoyed himself and if it was nice.
Well, I think it was an important event because it honored the people that have been working at the hospital for over the past year dealing with the pandemic, and saluting them and honoring them for all the work that they did and give them a chance to sort of celebrate together. And, we're marching around with a bagpipe band, and then Jessica's getting us all to sing together. So it was a good fellowship event to sort of commemorate a year of dealing with the pandemic.
That the hype man, Tom, the hype man. I'm like, how could just one person be singing? I know most of you know the song Rise Up, right? So you hear that song, when I rise up. I mean, people were just there like listening. I'm like, all right, everyone sing. Folks did start singing.
All right.
So that was
what's coming up?
Coming up is our Pride event on June 30th, in the same space on Marcus Garvey. I don't want to go into too much details because I'll ruin the surprise, but it's gonna be phenomenal.
There's a time and a location. What's the time?
Yes, so it would be from 12 to 2. We utilize those hours because it is the hours that our staff takes lunch breaks, but it is a community event and we want staff to get involved. We will be having performances, and it's community coming together with the hospital. So everything that I've been doing has been bringing us together, and it's going to be really nice. And I hope you guys can come and join us and play a part in it.
Send us a flyer.
I definitely will. We're working on it. We're working on the flyer, and once I have it, I'll send it to you. Futuristic events would be a health fair and a back to school drive. These are futuristic. I'm gonna begin working on the logistics of it. Some of the things I've been working on is like for the back to school drive, I would like for the staff to give back to the community, just as we did with the coat drive this year for the winter time. Community had done so much during COVID and helping us. So I had staff, you know, I said, let's do a coat drive, and we were able to gather almost 600 coats to give to community-based organizations, shelters, churches who identified folks that needed, you know, families that needed coats and stuff. So I want to do the same thing for the back to school drive with backpacks, have staff give back to the community. And
Now, does the hospital participate in National Night Out that the police department does? Do you guys do a table or anything like that? Do you?
I haven't done it. I just started last year. It's January 27th, but it's something that I would love to do.
All right. Well,
I had
Captain.
initially started
is
going
here.
to the meetings.
So when we get to Captain Fay, we'll find out what's going on with National Night Out. And what are you planning for your birthday?
My birthday, I don't know where we're going, Tom.
I thought you were having an event at the hospital. Anyway, move on.
Which event was it? I'm just doing so many things. I can't recall everything. So moving forward, let's go by your agenda. I wanted to make you also aware, Cut the Red Tape is one of our collaborative partners. And they just got a million masks that they're donating to us for our staff. So during COVID, you know, we had PPE, but the PPE had to be used internally because there was a shortage of PPE. So in order for staff to be safe. So now they were able to get, we're going to do a kickoff. It's an innovative program for hospital workers through Cut the Red Tape for Heroes, and where they provide the hospital workers PPE to take home to protect their families and for their personal use, like driving to and from the hospital. So we're gonna be doing an internal distribution for our staff. That's another great thing that's taking place. And then I guess that's all with me. We move forward and call on the folks you need to call on.
All right. Well, the thing on my thing was how we're doing with the pandemic. So that would be Tanya. Right?
Yes. Hi. Good evening, everyone. Again, thank you for having me. So, as Jessica mentioned, I do oversee ambulatory care or outpatient clinics here at Woodhull. But I want to talk to you guys a little bit about what we've been doing for COVID. So good news is our numbers are record low, as many of you know, especially for New York City, which is awesome. We continue to provide COVID testing. So, you know, we've been providing COVID testing now for about a year, for 7 days a week, from 8 a.m. to 3 p.m. It's a walk-in clinic. Obviously, our numbers and the demand for COVID testing has gone down as more and more people get vaccinated, which is great. And our positivity rate is also really low. But, you know, we want to still have that resource for the community for anyone who wants to get a COVID test. In regards to the COVID vaccines, our COVID vaccine clinic has been operational now since December, since we first vaccinated our first patient. Since then, we have vaccinated over 35,000. We've given over 35,000 vaccines. We continue to administer the Pfizer vaccine here at Woodhull. We accept walk-ins from 7 a.m. to 5 p.m. daily. And our vaccine clinic is open from Monday through Saturday. And that's all I have for in all things regards to COVID. So some really great news. You know, we're seeing our numbers go down. Our positivity rate for health and hospitals has been about hovering around 1%. So that's also really great. And we continue to promote vaccination for the community and to make sure that we're able to get everyone vaccinated when they want to. As many of you know, the federal government has approved vaccination for children now, ages 12 and up. So as of last Friday, the 14th, we started vaccinating kids. So all of our kids 12 and up who want to get vaccinated are able to get the COVID vaccine. I don't know if you guys have any questions.
So are the 333 Roebling site, is that connected with you guys, or is that a separate operation from Health and Hospitals?
That's a separate operation. That's not a health and hospitals operation. It's probably run by the city or the state, but it's not a Woodhull or a health and hospitals site.
No, I'm sorry. I'm sorry. It is a health and hospital site. It's a Gotham site.
Oh.
And right, as you know, Gotham is the ambulatory care wing of health and hospitals. That's the Jonathan Williams houses, right?
Yes. Okay, yeah, that's where I've gotten tested, and so I just was wondering if it's you guys. Okay, all right. Anybody have any questions of the committee about the COVID, vaccinations, the testing, anything like that? Any members? All right. So then we had, I believe that there's been discussion over years, like at least I've heard of it, but I'm not real clear about the emergency department and what was happening there,
Cliff, are you on mute? Cliff, are you on mute?
Yes, now I'm unmuted. Sorry about that. Good evening, everyone. Sorry, I don't have a camera on my my PC, so you're not seeing my face.
Oh my God.
But I will tell you that we're very excited about the new ED renovation and expansion project. We recently completed the hard construction, the major portion of the construction, and we are right now going through the regulatory certifications and approvals. Just to give you a little background on our emergency department, we are an emergency department that was seeing pre-COVID upwards of 100,000 visits a year. And for our size, our emergency department is roughly 19,000 gross square feet, which is significantly smaller than the size of emergency departments with comparable annual visits. The challenge and the treatment space changes that we will see with this new renovated expansion. The Woodhull acute ED, the adult acute ED, has a total of 22 treatment spaces right now. And it's about 15 treatment spaces less than emergency department with volumes of ours. The newly designed emergency department will increase the number of patient care spaces by about 75%. So we're going to go from 22 spaces to about 38 spaces. And the largest discrepancy in the gross square footage of patient care space. So our Woodhull's gross square footage per treatment space is about 300 gross square feet per space. That's half the size of patient care space in a community hospital. So with this new renovated expansion, we're going to be up to the standard. We're going to have about 500 gross square feet per space, and that's comparable to industry standard. Right-sizing these patient care spaces will definitely dramatically improve the patient experience, the privacy, and the safety throughout the hospital, throughout the emergency department. Part of the renovation, along with the 16 additional spaces, is new state-of-the-art nursing station, lighting, seamless flooring, negative pressure isolation rooms, which we currently did not have, and these negative pressure isolation rooms are going to have an anteroom, and obviously in today's day and age with COVID and all the other emerging infectious diseases, you know how important that is. So we're excited to have those in place, and it's really, I have a PowerPoint presentation that I could share with the group I sent it to Jessica so that you could see give you a visual, some pictures of the new expanded ED, what it looks like, and it's about an additional 5,000 square feet adjacent to the existing emergency department. Excited about it, and hopefully in the next month or so, we're going to have that opened up to the community.
All right, so Jessica said she forwarded it to me, but I don't, I'm technologically deficient, so, I don't know how one shares those things. Jessica, can you share it, or
No, Cliff, you can share it, right, Cliff?
Yeah, I think I can. Let's see.
Marie, you have to let them share, right?
You should be. Do you see it now?
Yes.
You see it?
Yes, Cliff.
Okay, so that is the rendering of what the new ED looks like. That's a picture. The second slide here is the blueprint, which has the additional treatment space, nursing station, another blueprint. Now this picture here, the white section is the new renovated space. Everything that's existing. And this used to be, the space that we've renovated is our old CPET, our old psychiatric emergency department. That's the space we've renovated and opened up. There was a wall separating the existing acute adult emergency department with the old psychiatric emergency room. So this space is being blown open, opened up, and it's now it's going to be one big, huge adult emergency department. This is some of the numbers that I was speaking to. So when you look at a community hospital, it tells you the gross square footage, and that yellow line is currently where Woodhull is at. So we're about half the square footage of what a community hospital is, but this renovation, we're going to be up to industry standard. And some of these notes here are points of what we're gaining with this new renovation. Upgraded nursing system, nurse call system, replacing the head walls, more bathrooms, negative pressure isolation rooms, and we're also creating additional space for care management staff, a transition discharge hub. So a place where once a patient has been seen and evaluated, then at the time of discharge, we'll have somebody that goes over their plan with them, their discharge plan, making sure they have follow-up appointments, a financial investigator that can follow up with patients following their visit, and making sure all their medications are in place and they have the right prescriptions and the appointments that need to be made. And really what our anticipated outcome is looking at approximately 75% increase in treatment space, as I had said earlier, improving access to care management and social work, just a much improved patient experience overall. And here is just a couple of pictures of what it looks like, a little sneak peek. Nursing station that was just put in. And there's another view. And that's another nice view of the nursing station, which has nice Corian tops. It's built-in sinks into the nursing station. This is the negative pressure isolation room, one of them. So we're really excited. The staff is really excited. We're energized and really looking forward to the grand opening of this area, this space. Any questions?
And will that speed up emergency room service time?
It will. I mean, it definitely will. So, I mean, our times are pretty decent right now, but we obviously always have room for improvement. So right now, our door, from the time a patient enters to the time a patient leaves, we're a little under 3 hours for our treat and release patients. For fast track, for the lower acuity cases, it's about 2 hours. But we're making some nice gains, and we definitely will see that with the new expanded space as well.
Anybody have any questions? Committee, anybody? Well, thank you.
Welcome.
And our budget requests, I believe, we put that in, I think that emergency room stuff was in the budget that we always, we have the budget report of the community board, and I think that was always included in there. So it's good to see that some of these things happen. So, and that's where my cab representative, where is she, used to come back with the things that the hospital needed, and we try to add them to the budget, which is why we need a cab member.
Here,
Huh?
I said,
Maria?
I'm here, I'm listening.
Right. So you used to bring us those things to the budget committee,
That are coming.
right? Maria?
Can you repeat that? Yes?
You
Repeat
used to
that.
bring those needs to the community board so it could go in our budget request.
Absolutely. That's why you need to recruit someone to replace me.
We all need to recruit someone to replace you. Okay. Now remind me, Maria, why I have women's pavilion on my list. Wasn't there something going on with women's program services, something or other at the?
That would be Lisa Scott. We had gotten some money from the senator. So Lisa would report on that.
Great.
Absolutely. First off, I just want to say on behalf of Woodhull leadership and staff, how much we greatly appreciate all the overwhelming support that we receive from the community. So thank you once again. I can't tell you how appreciative we are and how much we counted on it throughout the whole crisis. And you never disappointed us. So thank you very much. We appreciate it. So we have lots of good news from Woodhull tonight, and I'm going to add to the good news. We have a Women's Health Pavilion project that we're proceeding with. We got a very generous grant from Senator Salazar's office of $3.5 million, which can help us to move forward. This will allow us to create exam spaces, 26 exam spaces, social work space, nutritionist, financial counselor, HIV, phlebotomy, breastfeeding program, among many other programs that we'll be able to provide exclusively for women. And it will also allow us to co-locate the Women's Health Pavilion on the 7th floor so that the 7th floor will provide all women's health services in a confidential, private, comfortable, beautiful space. So we're looking forward to this program pretty soon to begin.
Wow. Very nice. Do you have like a blurb thing or a flyer thing or a descriptor thing or something you can share? Because when I do my report to the full board, I think they would all like to know about this, and particularly the Women's Issues Committee would want to hear about this as well. I know Jan Peterson is the chair of our Women's Issue Committee, and we try and cross over issues from different committees, so that's great.
Oh, fantastic. Yes, we can share. And I know Tanya has information on that as well. So we'll be very, very happy to share. And hopefully some of those women can come into Woodhull and take advantage of our new space.
Excellent. Excellent. Committee members, anybody have any questions about this for, is it Dr. Scott?
No.
Yes, it is Dr. Scott McKenzie. But Lisa is fine.
Okay. I don't want to be disrespecting.
Also speak on the facade.
Yes, that's
What was
another
that?
piece.
The facade.
The facade rehabilitation
Oh, I didn't have
for.
Oh yeah, I forget all the projects. So thank you, Maria.
Okay.
Jessica.
Oh, Jessica.
Yeah.
Maria.
I don't know. I can't keep track of who's talking. These little square boxes, I can't see whose mouth is moving. It's like the boxes should light up or something. I don't know. Well, they do. A blue square goes around you when you speak. Oh wow. Okay. All right. So anyway, facade restoration.
Absolutely. And for those of you that have seen Woodhull over the years, for the last few years, we have that really ugly scaffolding around the building, and we've been working to find funding to move ahead with the project to upgrade the facade and to make it safer for pedestrians and for the inhabitants of the building. So we've finally been funded, and we also have a vendor on board that has already started working. But I have to tell you that it will get worse before it gets better. because we've had to add additional sidewalk fencing and bridging, and so it's more than just scaffolding now. If you see the building, there's a little more protective equipment around the building, but it's needed because obviously as they're working on the upper parts of the building, we don't want there to be any debris or anything else that could fall to the sidewalk and hurt someone. So it will get worse for a little while, and after that, once we're able to complete the rehab of the facade, we'll be able to take all of that away and continue to beautify Woodhull.
Excellent. Excellent. So, anybody have any questions or concerns about that? Okay, quiet group. Now I got to go back to my little list here. Dr. Lilu?
Let me unmute myself. Yes, Kelly's okay. What?
All right, you're the executive director of?
I'm the associate executive director for behavioral health.
Okay, I knew it had to be some fancy name.
Yes. So in charge of all behavioral health services, which again, I don't know how many, if you want to review all the services or some changes that we had, or how we want to present that.
Well, if you just gave us a brief listing of what behavioral health includes, and then I think the thing that was most important was, the house. I think there's homeless housing that's provided on site over there, but also the services that are provided for the people that are homeless, and emergency outreach services, like response to 911 calls for emergency incidents, things like that.
Right. So, yeah, so we have two access points, if you want to call it, or entry points, one for urgent and one for non-urgent. I think the best way to know all the services, if I walk you through those entrance points. So if someone is an emergency, needs emergency services, they would come to our acute ED and they will have a triage, a quick triage, and then refer to the comprehensive psychiatric emergency program, which is called short CPEP. We used to be on the second floor, and we now on this fifth floor, and much bigger and space that we had before on the second floor. So that really allows us to not only to see more patients, but also to provide it in a very spacious, comfortable, and calm environment. So from there, they can stay up to 72 hours, which includes also extended observation beds that we have 6. So someone can come, they can see him for a few hours or less than that, or they can stay up to for observation, or they can stay up to 72 hours. If they need further services, they'll be admitted to the inpatient. Over there, they say 2 to 3 weeks or even longer if needed, but generally our average length of stay is about 20 days or 90 days in the inpatient. From there, they will be followed up in our outpatient clinic for adult. We also have an outpatient clinic for child, but we don't have an emergency room or inpatient. So children...
That was going to be my question, is whether you had an adolescent psychiatric facility there or not.
We have an adolescent outpatient, but not an inpatient. So if someone needs an inpatient, they're still going to be seen by our pediatric emergency room. On the medical side, then our consultation liaison psychiatrist will see the adolescents, and if they need admission, they will be transferred to one of our facilities, or if another facility if we don't have bed. Generally, we have bed. That would be Bellevue, Kings County, or other facilities at H&H. Other than that, for adolescents, that will be mostly outpatients, which we see families as well in the outpatient area. We have also a mobile crisis unit, which also would go, and they would also see adolescents in the community as well. So if someone needs an emergency service and the person or is in the community and for whatever reason the person cannot come here or be taken here, our mobile crisis service will go there sometimes within 2 hours, and sometimes if it's not so urgent, within 24 or 48 hours. So we have three level of response: 2 hours, 24, and 48, depending on the urgency. And sometimes if they're seen, they are either assisted to be brought back to our CPAC, our emergency room, and evaluated further. That's for the adolescents. For the adult is really more expanded. We also have what we call an ACT team, which is assertive treatment program. And there is a program designated for specific patients who, for whatever reason, either did not comply or are there with outpatient. They cannot come or don't want to come, and they rather be seen in their own environment, in their own apartment, home, or other area that they are, like community service or residence. So that ACT team will follow those patients, continue to see them on a weekly basis, and they will go to them instead of waiting for them to come to us. So
what are you calling that? Acting?
ACT, ACT, assertive community treatment.
Okay.
And the city has a few of them, obviously, and we are one of them that we service the communities around Woodhull. Usually the referral is to SPOA, single point of entry, which is a city service. So that's how we get the referrals, which is different than a mobile crisis. If you're a mobile crisis, they also come to center, but anyone can be referred to them. To ACT, you have to be designated. You have to have a certain history that you need that service. So that's a certain screening there. And those are really what we call patients who are really in the most need and are not able to access outpatients. That is basically what I want to add, which was the different and change. We also have a substance use disorder clinic. We used to have a detox unit, which was an inpatient. Patients who are substance abuser and would need detox assistance with that, they would be admitted to our inpatient detox for 4 or 5 days on general, and then continue in outpatient. Beginning of middle of last year, 2020, we transitioned from the inpatient to the outpatient. So now we have an outpatient detox service, which is also here on the 9th floor. Same patients, they come, they use the same service, but they use it during the day, and they go back to their house, home, or residence on the evening, and they come the next day. They usually get the services for 4 to 5 days. It's a very good alternative service to inpatient. So you don't have to be an inpatient and assist yourself with this service. I think that's basically, we have a homeless residence actually, which is the Communal Life. It's actually an initiative that is headed and led by Rosa Gill. And they build in the back of the hospital, they build 94 units, which 54 of them, I think they are for patients, and 24, I think, or so are for community residents. And I think they are planning to build another residence also in the back of the hospital. Now we screen patients who may be appropriate for this service, and we facilitate and help and support to have patient transition, those who are homeless or at risk of being homeless. Sometimes patients are not yet homeless, but they are in a situation where they may be homeless and they don't have a consistent or environment where they can live. So we assist them with the application and so forth, referral, and then they screened. And we have most of our patients at that time when they open, were able to secure apartments in that residence.
I have a particular interest, and then other people may have questions, but the mobile crisis unit and the response, and then having adolescents come to the emergency department and then farmed out to other places. Working in the family court, I see a lot of families, the children act up, and then they call the police to come to the house to get their kid under control, and then everything gets out of control, and suddenly we have a resisting arrest or assaulting a police officer. what's been the experience with Woodhull with those kind of calls, or even the kids in the schools, some acting up? Do you get a lot of those responses, and how well are you working with the police department when you go to those family or school situations?
Yeah, that is part of the initial screening. So we respond to, I would say, urgent, emergent, but not crisis. Because if the adolescent is in a situation where they are in a crisis, they are dangerous to self or others at that time, and we then would call EMS or police and will be there to assist them in this transition in terms of really transporting the adolescent to the emergency room to be evaluated further. Less than that, we generally go there and we support the family, we support the adolescent, we're trying to have the situation de-escalated and work with the family. We sometimes follow up, come to the next day, we go back if needed. However, sometimes we even facilitate, if the adolescent is cooperative and the family, we would help them, assist them to go to the emergency room for further evaluation without involving the police. So it's really the matter of how urgent our crisis and how dangerous the situation here we're involved. The police is really the last resort of that we would engage them. However, we sometimes need that.
Anybody else?
I'm sorry. I just wanted to make a comment. First of all, I'm so glad that you did bring this topic up. It's really not the role of Woodhull. However, it is a consistent need in the community, as you know, and it's a sobering thought when you have a child basically that's in crisis and they do need help. And you're right, the response right now, the citywide response, is to call the NYPD in for that. And I know that there are several models that folks are thinking about across the city to try and have other types of personnel respond to a crisis event such as that. And I would hope that we can really move forward and find a model that does work for New York. Again, it wouldn't be something that Woodhull would respond to, but we really do have a need in our community for some help.
Thank you.
Tom, I have actually would like to get more information with the contacts and the telephone numbers, the services that are available for the community. And one question for Dr. Lilo. This is a multi-language community that we're dealing with. I understand you have the translations available for different people from different backgrounds. Is that correct?
Yeah, that's correct. And let me answer you first. Your first question, we have a nice brochure, which I can give to Jessica. She will give you, and as all the contacts numbers and the programs that we have here, the one that I just talked about. We also have a nice flyer which describes the new open outpatient detox, which we call, also has the contact numbers for that. And yes, we have different translation capability, whether by what we call a Syrocom or linguists that we assess. We also have, we always try to have multilingual staff that will serve the community. So we have a staff that speaks Spanish or speaks Polish sometimes, depending on the need. But we do have, and we're able to communicate with most of our patients in their language, the preferred language.
Thank you.
So Jessica, you're going to be providing us with a number of things so that we can get it to the full board, so everyone has that information to bring back to whomever they are representing on the board.
I'll send you all of the brochures, everything. I'll bombard your email tomorrow.
Well, you just have to get like one set of it, and then Marie can attach it to our report and then get it to everyone else, right, Marie? Does that work for you, Marie? Marie's
That's
listening.
fine.
Okay, all right. Thank you, Marie.
Oh, I just want to say that whatever's uploaded during the meeting, the system doesn't save. So the presentation we saw earlier, we would need a copy of that as well.
Sure.
No problem, Marie. I'll send it to you guys tomorrow.
Great, thank you. Anyone else on the committee have any questions on the various things that we've covered so far? Any input, back and forth, anything? All right. So they're still trying to get somebody on the cab committee. We have to get somebody to volunteer to be on the community advisory board. Someone needs to volunteer or be recruited from the community board. So it doesn't have to be us, it could be somebody. Unfortunately, we're not at meetings to go beat each other up in the swinging 60s and pin somebody down, but we really could use somebody going to those meetings just to continue a relationship with the hospital. Maria did it for a while.
I'll go back. I'll go back
What?
if they'll have me back.
Well, I know what the hospital's rules are about that. We
We have to change Maria filled out the form. She wanted to come in as a community, not community board one representative. So it's just a matter of changing something on there. We can do that. Tom, I'll take care of that.
Okay. Thank you, Maria. Thank you, Jessica.
I just feel bad this time.
You did such a good job, Maria. That's the problem. No one else thinks they can match you.
Oh, wow. Yeah, right. Thank you so much. Thank you. I'll take it. I'll take it.
Maria, you are very knowledgeable and you perfectly express all the needs that we have. So you're it.
All right. And so anybody else have anything to inquire of the hospital? Does the hospital want to tell us anything more? Is there something you need us to be doing in the near future to support you in something? Now's your chance.
I'm gonna forward you all the flyers and the brochures. And whenever we have events, I think it's important. I've been trying to get more and more community involved. We've been seeing a really big turnout. And it has raised even staff morale. Like I put signs around the building. Woodhall appreciates the community. That's what greets you when you walk over here. But when you come inside to my magical room, I call it my room of magic, where the distribution took place, you'll find signs even in the hallway that says the community appreciates you. So I think for the first time in a long time, staff actually like now sees community even more, like really playing a part in everything that's taking place here. So just, I ask that if you can all, just forward the information when I send it. I try my best to send as much as I could to community board, the CB1 email. But I will forward you. I'm gonna just bombard you guys with all the stuff.
Thank you.
And I just want to remind everyone that now that COVID is starting to wane a bit, we have a campaign to welcome our patients back to Woodhull. So when Jessica gets all those materials over to you, if you could please make very good use of them and remind folks, it's time to follow up on those exams you missed out on. It's time to check out your health to make sure that our community is as healthy as possible, and we'll be here to welcome you.
One question just came to my mind. You guys have out facilities, right? Like clinics in the community that are attached to you?
They're attached to health and hospitals. They no longer are attached to Woodhull Hospital, but we do have the Gotham. All of those sites that you remember are now under the umbrella of Gotham.
Okay, so when you say, so that's like if we're having issues with if we want to know where those sites are and what's happening with them, that's a whole separate universe.
Yes, if you wanted to know where all the sites are, we could probably help you to get that information, but it's under the umbrella of Gotham. So it is a separate entity from the hospitals.
And those are community-based clinics or what?
Correct. They are. Community-based clinics, health centers.
Are they urgent care?
No, they're not urgent care.
Okay. So if somebody came in there and was like, went there instead of the hospital emergency room and were bleeding all over the floor, what they would they have a connection to you, or they'd send them somewhere else? I'm trying to.
They would try to get them to another health and hospital, acute care site, or trauma care site for whatever it is they needed, but they would have to call EMS.
Okay. So it's not like, I go to Mount Sinai's facility on 7th Avenue in the Village for their their community-based emergency room, and then if they decide I need something else, they send me to their hospital. You don't have that kind of setup.
Not yet.
Not yet. It's not, what I can say, I can speak a little bit on it. Basically, it's primary care. It's largely primary care, and they have women's health services in the community clinics. But many of our primary care patients who receive care there are referred to Woodhull for specialty care. So here we have, for example, neurology, cardiology, endocrinology. So many of our patients from the Gotham sites who receive, primary care from the community clinic do get referred to Woodhull for specialized care. So we do have that sort of partnership, and we want to keep our patients in the health hospital systems, primarily because we have one EMR. So if a patient is seen at a Gotham site and then they come here for, let's say, peds subspecialty, we can see their record. It's all one system. Right. So that's the benefit of having that sort of partnership.
Right. Just a reminder, if it is acute or a trauma, it's not going to go to the clinic.
Correct. Yes. If it's an acute situation, trauma, it doesn't go to a community clinic, they would probably call 911 if someone showed up at one of the community sites with an acute issue. But for primary care, women's health, those services they do provide, but many of those patients are able to come to Woodhull for specialized care.
I think I just have an old memory of when the emergency department was not going to be improved or was having difficulty getting expanded, that we were like, well, maybe the community clinic should be like community-based emergency room. So everybody's heading to Woodhull site. They were going to other places. Yeah. But
well, for those of us, I'm sorry. For those of us that have been around a while, you're right. That was a model a few years back where there was some talk and some discussion about having some more sites around the city, but it never really got off the ground. And now with the emphasis on more primary care for those non-acute issues, the model that we're using now is that the acute care hospitals would handle any of those issues, and then you would have the Gothams and the ambulatory care clinics that would handle everything else, all the specialized care. But I do remember that time too.
Yeah, okay. I wasn't dreaming it. All right, well, that's great. Thank you very much. Greatly appreciated. Keep connected and work on getting Maria back to her spot. And then she can tell me when there's meetings and I'll show up, because I did show up once in a while myself. So, all right. Well, thank you.
Thank you.
All right.
We're going to log off, Tom. We've been in since this morning. God bless you guys. Thank you for everything.
Thank you all. I'm glad to know about the enhancements of the emergency department and everything else, and Dr. Lilu and Lisa and all the work that you guys are doing. It's great. And
thank you.
Special shout out for what you guys endured during the height of the pandemic. And it was really hard. I know how hard you all worked. Cliff, I know the hours that you were investing, not going home, days on end, everybody, very admirable. And I just want to, I'm just one person, but really thank you.
Thank you. Thank you.
Thank you.
Thank you so much, Maria. And welcome home.
Tom, we'll see you soon as well. All
right. When is that Pride event again? Send me that flyer. When is
30th, June 30th from 12 to 2. June 30th from 12 to 2.
Oh my God, I think I'm on an airplane at that time, but I'll see. I'll check it out.
Okay. I'll call you so we can do a live. You can see it live.
I'll watch it from the plane.
Take care. Hi, guys.
Thank you.
All right.
Good night.
Okay. Now, Captain Faye, where'd she go? I know she's out there. Something's happening. Somebody's going in and out of the room. Okay, I see Officer Molina. I see you there.
I'm here. I'm not in uniform though.
Oh, there she is. Oh, she's got the fancy staircase and the fancy chairs and the stained glass window. Wow. So what's happening at the 9-4 now that it's spring and summer's coming, and are we opening up, and are there events going to be happening, and what's exciting that the community board should know about?
There's a lot of things happening as usual in the 9-4. First, we're We're up a little bit for the year in crime. We're up about 18%. That's driven primarily by our burglaries and our grand larcenies. We're up about 48 index crimes total from last year. So it's 311 versus 263. The good news is that we're down in domestic violence crimes significantly year to date. We're down 27% in index crimes, and we're down about 8% in all other domestic violence crimes. So we're happy about that, and we hope that trend continues.
Now, I'm assuming that the burglaries and the grand larcenies are packages and
A lot of the
motorcycles.
It's a mix, you know, with the burglaries. We got a lot of construction going on, so we got a lot of construction site
Tools?
burglaries, tools. You know, we do have the packages that are stolen. What we're seeing now is catalytic converter thefts really spiked.
Oh, God.
We had about 9 of them out of the 30 grand larcenies. 9 of them were catalytic converters. So we're doing a couple.
Is there a particular neighborhood that's happening, or all over?
So we had 9 in Greenpoint. I talked to Captain Wise from the 108. She's had over 20 of them. You know, we're looking to see. We're going to do some scrap metal inspections with Auto Crime Unit. We're going to reach out to DCA because they do a lot of licensing of these places, just to make sure that you know, these businesses aren't creating a location where people can go and sell stolen catalytic converters. You know, we are seeing homeless people moving through the command with buckets of just scrap metal. You know, there is an administrative code law on the books that prevents the transmitting of building materials on the street. You know, I'll speak to the district attorney's office. I don't think that they're going to be very interested in pursuing that. You know, I'm sure it was on the books for many years, and I think you know, we'd really have to get a commitment from the district attorney's office before we just start going down that avenue. It's not a penal law code. You know, and again, we're seeing it's mostly disadvantaged people that are, you know, probably just trying to get by and stealing the scrap metal. So, you know, we're interested in it, and we're taking a look at it. You know, but we want to get creative about the solutions we employ.
The question that came to me, and I saw it on the news today, is I'm just seeing an increasing numbers of delivery people upgrading from electric bicycles to full-size scooters without license plates. And they seem that they're beyond that crazy state law about what counts as a motor vehicle. It just seems there's more and more regular full-size scooters being used for deliveries. What kind of enforcement's going on around that?
You're right. The problem that we face is, you know, I think there were confusing state and city level moratoriums, if you will, on certain laws that we had in place, regulations that kind of said we want to let delivery people get around. So e-bikes were now kind of off limits for enforcement. Definitely the dirt bikes are citywide. It's a problem. You know, we can do operations like we tweeted something out about if people have intelligence about where these things are being stored, you know, certainly we can surveillance, we can conduct operations. You know, we really have to have a concerted effort. If we go to pull them over and they start to run, you know, NYPD policy is not to give chase. It's a public safety concerns as well as the officer safety concerns. And you know as well as I do, it's not the law-abiding citizen that you know, is going to stop. So you know, we wind up we have something in place where all my platoon commanders are going to be doing vehicle checkpoints, especially as the summer gets underway. But you know, we're going to catch up the law-abiding people in these checkpoints because you know, the people that have criminal intentions are just going to take off. So that's a challenge. You know, when we see it, we can work with highway, we can request other resources to help us. Certainly if they're not registered, we can seize them and we can do operations to that extent. So, we have to be careful, obviously. There's a lot of delivery people moving through the precinct, so we want to do it, correctly, and we don't want to make enemies of the community. So, yeah, I mean, we're setting up a strategy, but certainly the 911 calls have been exploding, not just about the dirt bikes, about a lot of different things. So we are well aware of the problem.
Well, so you're saying you're getting 911 calls on the dirt bikes. Today on the evening news, there's a whole, the chief of patrol or somebody was speaking on a new effort by the police department to go after the dirt bikes and the ATVs. So is that citywide? Are they just focusing in Manhattan, or?
It is a citywide problem, so it's just, we're going to need a citywide solution. There's, I know it's not just the dirt bikes, it's the car meetups, it's the speakers, the gigantic speakers that are on cars. It's a quality of life, many quality of life concerns across the board. So certainly, I didn't see the news that you're speaking about, but I know that the chief of patrol has been speaking to all the commanding officers about, dirt bike seizures when we can see them parked. Maybe that's more helpful if the community calls and the bike's unregistered. We certainly can get tow trucks to come. We can get a van and seize these unregistered vehicles. The challenge we're facing is that it's very rare that they're parked.
Right.
They're on the move.
Okay. Well, I mean, I got the dirt bike and the ATV. What I've been seeing is that, the standard Square Box, Grubhub, Uber Eats food delivery guys seem to have these higher priced, more powerful scooters, which I would think that their restaurant or somebody is buying for them, and somehow that get the restaurants to stop, running unregistered vehicles. It's just, I don't know how we can deal with that. I mean, it's like the guys are operating in regular traffic lanes and operating whatever, but they just have no registration. So if they ever hit anybody, it's like, who's going to get stuck for it? It's just a weird, I've seen more and more of those. It's like,
it's a huge problem, and they were always illegal, and there's like a proliferation of shops selling them. And it's I walked by a shop in Maspeth, they seem to have these, they're advertising them. And it's probably, if they have a house upstate where it's legal, they're probably getting around being able to purchase it here. If they take it away unregistered, and I don't think that the person selling it really cares at that point. But we had this with when e-bikes were rolled out. I think I was in the Upper West Side at the time, and we were writing the poor delivery people summonses. When we did go to target the restaurant owners, it's very cost effective for them. So it's very hard. A lot of them will take the summons and pay it. We were seizing the e-bikes. I have to get clarification from our legal bureau, because a lot of these pandemic, dictates we haven't seen officially rolled back yet. So,
right.
Once they're restored, and it's, again, across the board, I haven't seen anything from, internally, we kind of have to citywide from City Hall, even as far as sound permits, we're kind of, we've been issuing them for the city cultural events. So people are coming to us now. It's the summer, they want to be in compliance with the law, but we kind of need a reset where we go back to the pre-pandemic regulations if that's what's, if that's what the city officials decide we're going to do.
So now they're just saying it's post-pandemic. I saw Bogdan's hand, but then I saw Bogdan disappeared. What events have applied for the summer so far? Are we going to have a feast? Are we going to have outdoor concerts? Is anything on the horizon?
I know the good Monsignor Jamie, is hoping. So I think there's been, it hasn't gotten to our level yet, but I know they're having strategy meetings, and I think they're proceeding as if they're going to be able to have the feast in some form. Like I said, this is we see it as a day-to-day kind of operation, because the mayor, you know, has not publicly said things like all the parades in June, the Puerto Rican Day Parade, the Heritage Pride, I think are still virtual at this point. So
Right.
I don't know if that, you know, now 4th of July rolls around, if anything's changed. You know, it's the masks are coming off, things are coming back to life. So it really is a day by day operation for us. You know, it kind of, you know, Dave, Tito, myself, we're willing to work with anybody that's coming to us. You know, that's what we're seeing, a lot of noise complaints from, you know, I don't know if Parks is making people get permits or not issuing them at all. But it kind of has created this environment where it's like a free-for-all.
You're getting 911s about noise in the city parks?
Yeah. In McGolrick, in McCarran Park, Transmitter Park.
Are they what, concerts going on, or just?
It's people that it's probably a mix of things. You know, it's definitely people that start there having parties. The sun goes down, the music's still on. You know, certainly they're from cars that are parking along the waterfront, Java, India. You know, we saw this last year as well. So, you know, certainly we've seen an increase in these noise complaints.
Okay. Are you going to be doing, have you gotten to the point with August yet with National Night Out?
So it's set for, I guess, August 3rd. You know, we've been working with, obviously, you know, President Betty runs the show, so we're following her lead. We're her supporting staff. You know, and I think we're in the planning phase. So certainly if Woodhall, if anybody wants to, you know, participate, I'm sure whether in the local precinct or if they have additional resources where they can, you know, come to other precincts, we'd be happy to have, you know, anybody, the more the merrier.
Oh no, did I freeze?
You froze.
No. Did I freeze?
Yeah, you're back.
Okay. Scary. All right. Bogdan, you've been flapping your hand at me, so go.
Yes, I have a just very short question. I would like to get back to the dirt bike. Did you notice, to the officer, to captain, did you notice that they were riding on Bedford Avenue yesterday, about 30 of them, including not just dirt bike, but also four-wheelers, and none of them had a license plate. Do you know that?
I don't know about that particular incident. It's very common now. We're seeing it a lot. So, you know, we're hoping that with vehicle checkpoints, we may catch them where we're forcing them into a safe location to stop. We may catch them unaware. But
I understand that, but I was very surprised because that was like around afternoon time, okay, around 1 o'clock, middle of the day, driving on Bedford Avenue from Williamsburg, going through, because I saw them on Nassau Avenue and Bedford, was like 30 or maybe more of them, including four-wheelers. None of them has a license plate, and most of them, probably as you know, Captain, are riding on the one wheel. You know that, right? So like if they go speed, they ride on one wheel.
no, this is, they hook up on social media. They put forth locations. It's, you know, it's not just limited to the nighttime anymore. You know, you have multiple recreational clubs that they film themselves. You know, they race. They go in a block on the expressways. They slow down traffic. They drag race after they've shut the expressway down. Yeah, no, this is a huge problem. And this is something that, you know.
I would like to just point that that's where they were driving, like middle of Williamsburg and Greenpoint, middle of the day. So that was nobody could stop them. Okay, that's one question. Second question, like every few days, they have a race on McGuinness Boulevard. Do you know that? And they go on one wheel, the back wheel, like it's like 30, 40 of them. So I don't know if nobody, they just go on one wheel from like a Nassau, crossing of Nassau Avenue and Norman, and go straight and between the cars and it's not just 5 or 10 of them, it's like 20, 30 of them. So every time I see them is more and more and more. That I would like to just bring that to the attention. Thank you, officer.
Yeah, no, and it's, listen, we just had a fatality on McGuinness, a very terrible one. A teacher was crossing and he was killed by a car that left the scene, a teacher from PS 110. McGinnis has been problematic, I think, way before I got here, and probably
absolutely. McGinnis always were a problem. McGinnis and Nassau, that was always 4 years accident and accident and accident. That is like very, very bad point, black point, I would call that.
So the traffic safety team does speed enforcement throughout the whole entire command. I've directed all of the platoon commanders to actually have checkpoints on McGinnis, not just McGinnis, but West, Kent. These are all thoroughfares, Greenpoint Avenue, where it's inviting to them. So it's very challenging right now. I'm not gonna lie. And when you have a group like that of 30, and I have an RMP, these become like police-related deaths if something happens to somebody. So
I understand you. Yes.
So we have to be very careful. If God forbid, when you're getting into those high rates of speed, if an officer makes a mistake, if a pedestrian steps out, we don't want it. We don't want to. It's better that, and that's the problem. If we have a reckless driver that has a license plate, we can do some investigation and find out who was behind that wheel. Hopefully, so this may be something that if we can't find a way to get them off the street, then maybe we better require that they be licensed so that they have insurance. Maybe that's legislative.
As I know, because the dirt bike with no lights doesn't need license plates, but when it's a light, you need a license plates. And also four-wheelers is when it's at some point you don't need a license plate, but there were all of them, all kind huge. So I believe to them they do need a license plate. And some of the dirt bikes, like not just dirt bike, regular motorcycle, that's 100% that's required their license plates.
And the ATVs they're illegal. Like they cannot be riding around the city streets. Unfortunately, we're operating at a deficit during the pandemic. I think people hooked up, they're well into this, tradition. I actually, over the weekend, we have the music going on, and Deputy Inspector Hall from the 104, they've been seizing speakers that are mounted on these cars. So this chief of staff for Robert Holden's office actually follows the group, because they broadcast on social media. If I set up a car that is underneath the Kosciuszko Bridge to deter them from setting up, they get on social media and they say there's cops here, go to the 108, go to the parking lot at the 111. So they certainly have spots. We're working with the intel to try to see if we can get ahead of these things, if we have notice of them, of where they're going to be. We also do our part in putting resources there so that they go somewhere else, but we're really just displacing them to another part of the city. There should be an overhead response to this, so that we're having the same message, and we're not just. I don't want to send it over to my colleague in another precinct. We really want to combat it completely.
Thank you very much. Oh, thank you very much, Captain.
And Bogdan, the problem with ATVs and dirt bikes is upstate. The law is a state law, and hunters and people who like to go off-roading don't want any regulations. So when the downstate people want to pass legislation to have it, that four-wheelers and ATVs get registered, the people who use them for hunting and going off in the woods call out their elected officials and no way are we making people register these things. So it's we have to carve out New York City somehow, like so many other things. And it's been a battle for decades over how to get this to happen. But Captain Fay, regarding the hit and run, is there any new news on the hit and run?
So I can't get into specifics, but I'm confident that there'll be, it's being investigated by the highway, by the collision investigation squad, and they've made some very good headway in the case. So
aren't there speed cameras in that section or not?
There was a witness and a dash cam. So
But aren't there speed cameras on parts of McGinnis?
Yeah, they're closer to Driggs. I think there's one on Nassau.
Okay, but not for that site. Okay. All right. Just wondered. Okay.
We did get LPR reading hits, so
Yeah, I made sure my video cameras have been working since we've had open streets, and every vehicle that goes down Graham Avenue is now coming down Manhattan Avenue. So you ever need a video to block between Withers and Frost, mine's working again. So
thank you.
so I got word from the 9. Oh wait, so anybody have any other questions for Captain Fahey? And David Molina's back out there somewhere somehow. Anybody? We lost Gio because he has school tomorrow. I don't know if anybody noticed that in the chat. All right. Well, I got a call from Captain Vasquez that there was a death in his family, so he wasn't going to be able to make it tonight, and Kenny was not going to be able to make it tonight either. So we have no one from the 9-0, but I did go. The 9-0 had a nightlife meeting with the bar owners and the bar to try and get ahead of any of the craziness that's going to be happening this summer with any of the big clubs. So I don't know if you've had any interaction, Captain Fahey, with the bar or heading off any of the
Not
you don't have
not recent. I mean, Mark has a lot more club type places than we do, but we certainly have been meeting with the elected officials to try to combat some of the noise complaints and quality of life complaints on the waterfront. We're still working on our Manhattan Avenue bid, trying to get that up and running. So we have a
correct. How's that going?
Yeah, we have a cleanup, I think, scheduled for June 12th. It's like a cleanup and a meetup. So the elected officials were invited, like people that are running for office. We'll have sanitation there. We'll have a table. And we're looking to do a small business meeting with the Small Business Association like mid-June.
Now, Bozina, Bogdan, and Arthur should all be on whatever your list is for that.
Okay.
Because they're the Polish presidents.
Yes.
they're like the royalty of the Polish community or something. When they speak, everyone follows or something.
Yeah.
So
We like the Polish mafia.
That's great.
Except we
Thank
are
you,
not
Tom. Thank you.
But we are not violent.
But Arthur, Divinowski, Bogdan, and Bozina, really, if you could add them to whatever you're doing with the safety Carter thing on Manhattan Avenue.
Yep.
They're working with the social service agencies. Bogdan has a business. Arthur has a business. There's this president's group that they meet with regularly. I think Bozina's very involved with the bank. Yes, Bozina? Yes, no? So they got lots of connections over there, and they'll get the word out and, keep them busy. They don't have enough to do.
Yeah, well, we're really, we're excited about it. It would be very helpful, once we have the business owners in place, because I think certainly our introductory meeting with the Small Business Association, there's a need here in Greenpoint, and I think it's just hard, from the police department standpoint. It would be much easier if the business owners are the ones taking the lead, and that they're in touch with the Small Business Association. So Will Vega, they were asking to have the really interested business owners, and then they can take it from there. So we're looking to go forward with it. It always seems, from the police department standpoint, something always gets in the way, like in our schedules. But if we can get this up and running, I think it would be, very good for the community.
Well, Bozina, Arthur, and Bogdan should be plugged in. And what's happening with Father? I can't pronounce his name.
We had the rally. Yes, we'll defer to you on the pronunciation. Yeah, we had the rally on Saturday. I was there. Hate crimes is investigating. Unfortunately, there's not a lot of cameras over there, so they're looking for any tips if anybody knows anything through Crime Stoppers. But we really don't want it to ever happen again. So I know everyone's come together to give it extra attention. It's locked at night now. And, you know, we have the NCOs keeping an eye on it. I'm keeping an eye on it. It was a very nice rally. I think it was a very good turnout. It was great to see the Polish Girl Scouts. So they're the equivalent of the Polish Girl Scouts there. It was a, you know, really nice day, and it was a great sense of community. And he was a great man. You know, I think the education part of it was really great. I think, you know, we had, Dave can tell you he was there too. There was a lot of people just passing by that would have never known about Father Jersey. So, you know, it was very nice to see the community come together, you know, unfortunately under those circumstances that it took that, but I think it actually renewed a lot of interest in the statue and in the education of it. So, you know, we were happy to be there to participate.
That's true, Tommy. If I may, that's yes. The Consul General was very nice. He did make very nice presentation, and that was really very good rally. But very good. Okay. By the way, your pronunciation, Tom, is very easy. Popie łóżko. Like kościuszko, not kościaszko. Kościuszko. Popie łóżko.
I was going to ask a question, Bogdan. What businesses are close to that location, if any?
I mean, Polish businesses?
No, any businesses. Like we're just saying there aren't video cameras over there. Are there any businesses?
No, the closest is that the restaurant, the Spitzer House.
Yeah.
Yes, so Spritzen's house, we might want to go in there and say, can you put one of your cameras focusing over there?
Actually, there is
part of their community relations that they could turn one of their security cameras so it faces that way or something.
Okay, but the problem is the Spitzer House, there is a deli, there is a few restaurants, but the thing is that there is a trees over different.
Trees in a way? Okay.
Yeah, I was told, Tom, that the credit union wanted to sponsor pay for some cameras to be installed in around the square. And the question is, how do we go about it? You know, do they need a permit to do it? How is it?
We'll have to talk to Mary Parks.
Okay.
You know, Mary Salig. We'll have to ask her how that is, because I've never seen, like, city parks don't seem to have cameras in them on any statues whatsoever. So there may be some kind of thing about security cameras in public parks.
Police and Federal Credit Union is sponsoring to buy the cameras and to put the camera. But of course, they need a permit or some kind of permit, and who's going to control that, and how that's going to be controlled? If that's going to be controlled for them, or is that going to be controlled by the park? Is going to control by one of the people who lives are next? But definitely, they are willing to place the money to buy the cameras.
Yeah, well, we'll have to look into that. We'll have to talk to Mary Salig about how parks, whether they allow cameras in the parks or not, because I don't recall ever seeing cameras on any statues in any city park. There might be some rule about it, because, you know, you go to the park and it's supposed to be just a whatever. I don't.
Yeah.
But Spritzen House, was there any video that was helpful at all from Spritzen House, Captain?
Like I said, the investigation is primarily, it's not in our in-house detective squad, it's the hate crimes. The last update that I saw, they did not recover any video, but it's been a couple of days since I checked it. So I will look tomorrow, and if there's any update, I'll let you know.
Spritzen House has a new owner, and we ran them through the ringer about being community active and community participatory and whatever. And it might be like, if you went over and said, you guys have cameras, if you don't have cameras, why don't you get some? Because you guys do it on my street all the time. An accident occurs and you go door to door and ask people who've got video. Even seeing somebody running that comes from that direction can be helpful if a place has security cameras, but I have no idea. So, you know, your NCOs make a friendly visit to that location and say, you know, hi, we're your NCOs. We understand you're a new owner. You got video cameras, or, you know?
Yeah.
Yes.
I'll speak to Inspector Corey because it's her detectives at the hate crimes unit. It's being investigated as a hate crime. So.
No, but I mean going forward as a community gesture
Oh yeah, yeah.
from that location, that they just are aware that, maybe they can angle their cameras a little bit just to catch the corner of the park or something,
And there is a deli next to it, and there is a restaurant, and one of these restaurant, I believe they have a rooftop seating, and so they could have a camera like very, very high located. It could be, I didn't notice that, but it could be on the second floor, and from the front, from the back, like from closer to Lorimer Street. So that's maybe they may have the cameras, and this camera would see that.
Okay.
Thank you.
Anybody else have anything for Captain Fay or Officer Molina? Officer Molina, do you have anything that you need to add to?
Dana, nothing for us?
I just text Melina, you guys are the 4th precinct I'm on a Zoom with today.
I'm glad that they wore you down.
They're wearing her down.
You guys are wearing me down. This is the 4th one, so.
Don't you have to recruit her for like softball or something, David? Or, some team thing? Let's wear her out completely.
Summed it all up.
All right.
Chips coach.
Thank you.
Thank you.
Ay. Keep us posted if you got announcement, if Betty's ready to do out, her event.
I will. We have our next community council meeting is the first Wednesday in June.
Live and in person, yes.
Yep, it's June 2nd. So she'll be in full planning mode. I'll let you know.
Yeah, I was on my way to the last meeting and my contractor locked himself out of the building and called me back to let him back in. And by the time I got back over, there was like no parking. I was like, oh, I gave up. And it started to rain. I said, nope, sorry.
Yeah.
I've already missed half the meeting by being 10 minutes late. So I was like.
And we had a small little bathroom fire, so you missed a lot of excitement.
Oh.
Electric. Okay. The good officers, Jerry and Dave, they ran right in. They proved themselves with their firefighting capabilities as much as their police tactical training. It was wonderful. Saved
Smoke everywhere, alarms going off, making a big scene.
No, it was like really quiet. There was no big scene. There was no alarm. Like if it wasn't for them noticing it, we probably would have been running for the exits.
Great. All right, keep me posted on whatever's going on. We're gonna have a community board meeting in June, and we're gonna have one in July because there's land use issues. So, and we'll be doing SLA. So you have the list, David. Yes, you have my bar list to look at and tell me who's a problem, who's not. For next Tuesday.
Yes, we'll get it over to you.
Okay. All right. Thank you.
Thank you, everybody.
All right, committee, we've lost half of our people.
I'm still
All
here.
right. Hi. So Gio wanted to talk about, illegal dumping, but that's sanitation, and he had to go do school stuff. Anybody have anything that we want to be adding to our agenda or get on an agenda or moving forward? Or
Tom, I have a question. How is the garbage pickup from the little bit of those city trashes on Manhattan Avenue? It become just such a nuisance. We have so much garbage falling out of the baskets and falling out of those metal boxes. And is this part of our committee, or should we?
We seem to get everything that nobody else wants. So I think sanitation is ours, like everybody. Let me look at my magic. I think everything falls upon us that nobody else wants until the outreach committee decides it's interesting, and then they take it from us. As I gather, they want to take police from us.
Yeah. Because that seems to be the biggest problem of Manhattan Avenue. The corner, Greenpoint Avenue and Manhattan Avenue, it's just unbelievable. And you know,
Are
the
people
graffiti,
doing 311?
I think they are. I may verify that even the business owners, the local business owners, they started to complain about it.
All right, when I look back at the old breakdown for committees, one listing of public safety and human services has fire department, police department, shelter, social services, aging, disability, and health. Yeah, so I don't know if sanitation belongs to anybody. We keep getting it because of the concerns about the cleanups underneath the BQE.
BQE, yes. But that's part of the homeless, I guess.
And your council member is over there is Steve, right?
Yes.
Yeah, see because over here, our council member, Antonio, is the chair of the sanitation committee of the city council. So I would say call Antonio's office.
All right.
But is there a business organization on Manhattan Avenue?
No, not really. On the corner, we have McDonald's, we have Dunkin' Donuts, we have deli, and then we have the subway entrances.
Yeah, like Captain Fahey's putting together this business group for safety on Manhattan Avenue.
Yeah, Tom. So if I can, this is Officer Molina again from the 9-4. Part of what we want to do on Manhattan Avenue is working with sanitation. They were at the Business Alliance meeting. We have a contact with sanitation now. It's their community affairs. The cleanup we want to do on June 12th is for graffiti. It's for garbage. It's for everything. So we could touch base. You know, either.
You got to get this information to Bozina and
absolutely,
and Arthur.
You should have suggested that earlier, Tom. I wish you had. But moving forward, we'll look into that.
Okay.
Like I said, Bozina, we'll talk either tomorrow or next week, and we'll try to loop you into everything.
All right. Thank you very much.
What's the business alliance called?
The North Brooklyn Business Alliance.
Do you know them, Bozina?
No, but I'm excited about it. Okay.
All right. That's who we have to work with.
Okay.
Yeah, Tom, I find the same issue over by me on Wythe. I mean, there's not even trash cans over on Wythe between, I guess it's probably between South 4th going all the way up to, North 8th. I mean, there's just no trash cans even on the street corners. And so if there's
I don't think Wythe was ever considered a commercial strip for trash cans on a corner.
And I know
we only get trash cans on the corner, like for Graham Avenue Business District and Manhattan Avenue Business District, and that's about it. Oh, Graham Avenue at the other end, we get trash cans on the corner. But I don't think Wythe ever rose to the level of being like a commercial strip that got trash cans on the corner.
So are there only, I mean, because I'm new to this, so are there only trash cans on the corner if it's like a quote unquote commercial district as opposed to a residential area?
Well, yeah, because the residential people are not supposed to be putting their trash in cans on the corner. The only people that should be throwing trash in a can on the corner is a shopper who's throwing their ice cream wrapper away or their soda can or something. It's not supposed to be the dump for the whole street, and then sanitation goes through the garbage and finds out if it's a residential address. If there's suddenly a bunch of businesses in a block that people are buying food or shopping and wanting to throw, then they'll put cans on the corners. But sanitation got cut way back in the pandemic. They're not even they were trying to get rid of doing regular pickups. What kind of trash is on Wythe?
I mean, it's just a lot of, bottles, cans, papers. I mean, even where there are cans on the corners, like I think on Berry, they're overflowing. I mean, there's garbage litter on the streets. And I know that from our last meeting, we were talking about how sanitation was cut. And I get it. But I don't know. It's just something that I noticed.
Well, I think Wythe runs through both council districts. Yes,
I believe so.
Okay.
Yeah, it does.
All right, well then go after Antonio because he's the chair of the sanitation commission and he's running for borough president.
Okay,
Time
sounds
is
good.
right. And his chief of staff is running for his council seat, so make them respond to constituent complaints.
Okay, sounds good. I will. I'll keep them honest.
Hey, that's what they're there for, you know, constituent services. My garbage cans are overflowing. Get somebody over here. But I think what the 9-4 working with the community affairs person at the sanitation, you met him last month, you know, he's a community affairs person. That's a new thing. We used to get the borough sanitation chief would come, who was like the guy who really went out and picked up the garbage. And then we had some former sanitation workers that were still on the community board, and they would be like, "Oh, come on, you're giving us a bunch of crap. What are you?" But the city's gotten more effective in charming us out of what we think our services are. So, but call up Antonio's office. Say, "What's with these trash cans?" You know.
I will. Thank you.
You know, and they're not writing littering tickets either for all those people throwing cans on the ground. So, you know, I don't think there's any enforcement going on. So, right, Bogdan? Because those the big belly things, those electronic garbage cans, I think they were a disaster after they put them in. You know, they're supposed to squash the whatever, and they squash, and then they overflow, and the thing breaks, and then it's like,
That's right.
why do we spend all this money on these big belly things? Just give us the old-fashioned metal cans that weigh a ton. They make great weapons in riots, but you know.
On the other cans that are really nice, but inside is regular can, and
Right.
actually that's already got the damage.
Yeah, so I don't think this is the regular pickup that there used to be. I mean, there used to be just trucks that went and emptied the cans on the corners.
Right.
And I think now it's falling on the regular route guys if they've got room in their truck to try and empty them. But go to Antonio's office and say, "Hey," and if he asks who you sent, tell him it was me. He's used to it. All right, I think that we've lost Dana. Did Dana like die after this? Yes, she did.
But lately they're writing a lot of tickets for the property owners if there's anything on the street, because actually the street parking regulation is just you cannot park one day. So actually the people are not moving the car for a few days, right? Technically, if there is you have to move the car on Thursday, you park on Thursday and is gonna stay.
We had 4 days this past week where it was suspended.
Right.
Monday, Tuesday, and then last week there's a couple days it was suspended.
And so in many cases there is something, some little trash, some plastic, or maybe even a coffee can under the car you cannot see, and they go by and then see from far. They know how to look at it, and they write the ticket. And before they used to write a ticket $25, you know, because that was whatever. And now it's minimum 100.
Yep. I've got one for papers on the sidewalk at 8 o'clock at night on a really windy day. It's like, seriously? Or after they pick up the recycling bag of cans that the guy has rifled through and left the top open and half the cans fall under the car that's parked there, then they come and write a ticket for the cans that are under the car. I know.
But that's happened lately a lot. This is not just single incident. That's they going and collecting and writing the tickets wherever they can.
They gave away all the sidewalk cafe permit fees. They got to get the money somewhere.
Right.
You know? All those sidewalk cafes that used to pay thousands of dollars for renting sidewalks are now all for free because we have to have open streets because, you know, COVID is a permanent condition, so nobody has to pay to use city streets anymore. You know, they made the sidewalk, the restaurants in the street a permanent thing now.
And how long is that gonna last?
It's permanent. Probably gonna be forever until we probably get a new mayor.
Oh my God!
This is
not just that, but this is really dangerous. That's one thing. Another thing, they are taking if you have a property on the corner, and so your property could be 100 feet deep, so you are allowed to have 100 feet to put that cafe on the street, and you how many parking spaces taking?
Yes, and how much revenue are we losing? That's why we're paying this $100 litter fines.
Mm-hmm. Mm-hmm.
You know, because we're property and we don't have 421A tax abatements like the luxury high rises on the riverfront. So, you know, it's a vicious circle. But call Antonio about those garbage cans on White. And Bosdina, find out who that North Brooklyn Business Alliance is and find out what they're up to, you know?
Okay.
And then get them organized. You know, they can get organized. They're going to do a cleanup. David says they're doing a cleanup. So get them some black bags. Get them some bags with the bank's name on it, you know?
Mm-hmm. No, absolutely.
And Arthur can go out there and, you know, hand out fans, you know, the funeral home fans, so that people can advertise the funeral home. It's going to be hot.
He's
June cleaning up.
He's so busy, Tom, that he doesn't need any advertising.
Need it. Unfortunately, he really doesn't need it. This is such an awful time.
That's true. That's true. All right. Anybody else? Anything else? Gio, you're looking for your button. Are you looking to say something?
Yeah, I had to log off and log back on. Did you guys talk about the dumping under the highway? Not the encampments, but the dumping. Forget about the encampments.
David?
Yes, Tom?
David's okay. Gio, the crossing guards are pointing out that garbage is getting dumped nightly under the BQE. Whose enforcement is that, and what can we, you know, it's a you, is it sanitation? How do we get that handled?
Do they have anything more specific? Like, is it coming from cars, from people, you know?
Gio?
Well, I don't think, you know, like DSNY goes around giving everyone tickets. They should just put the car underneath the BQE overnight and catch the dumpers. It's the same spots for the last like 3 years now. It's Kingsland and Meeker. It's Engert and Meeker. It's I have all the spots. I could email them, right? Because I've been complaining about them.
David's not going to do it. The guy that came.
I'm just saying, somebody could just put a car there and catch it's the same contractors that are just dumping stuff.
But I don't think the police department writes the dumping tickets. I think it's sanitation.
Well, DSNY. But I'm saying someone could just refer it to somebody, because there's no encampments down here, you know, in Kingsland.
Gio, come on, you've been doing this long enough. Nothing just gets referred.
Yeah,
I know, but this has been
the instant response is there needs to be a 311 complaint with a number on it that we can get somebody to respond.
Okay, so we'll do some 311 complaints.
And
like,
then you get them all on a note thing, and we send it to Jerry, and Jerry's got, here's the letter, dear old Department of Sanitation. We send a copy over to Antonio.
This has been the process of the last, I think I have 8 years worth of emails about this, warning about what's actually happening under there. All right, we'll start the 311 calls this week.
Yeah, and get the numbers, get the 311 numbers, and we get them on a thing. Because like yesterday, I called Rhonda because there's a red light burned out down in the corner. And she's like, Tom, you know to call 311. I said, no, it's Rhonda. I'm calling you. No, you got to call 311 first. So.
What kind of garbage is that? Construction garbage or just any garbage?
There's car parts, right? Bumpers that are down here. Construction, you know, like the parts of the, what is that? The chalkboard, the water board. That's down here. Vacuum cleaners.
Sheetrock.
Yeah, there we go.
Gio, we have dumping on Meeker between Leonard and Manhattan Avenue now too.
Yep.
Disgusting.
They got the U-Haul trucks in that gas station.
Well, that guy, I don't know how he gets away with what he gets away with. That U-Haul guy, unbelievable.
And what they do is that they dump overnight. Like the city can make a killing with all this illegal dumping tickets. Like they just got to catch them, stake them out, and get them. Like we got all the locations. But
there's no overnight commercial parking either in New York City, and those U-Haul trucks are parked there every night.
Yeah.
And those
Right.
tractor trailers that are parked on Meeker Avenue every night that are like 53-foot tractor trailers that shouldn't be parked out there. It's like, what's going on? What happened to the truck unit at the 9-4?
People drive through the neighborhood on Meeker. It's embarrassing, especially when you have a business.
Captain
It's
Faye, what happened
disgusting.
to the truck unit at the 9-4?
Tom, are you talking about the traffic unit that would come in and do the checkpoints, or are you talking about our highway
Oh, the
safety
big
team?
trucks that park overnight on Meeker. You used to go out there every once in a while and you'd write them big $600 tickets and then they go away.
We could look into that again.
Because every once in a while there's one huge, gigantic tractor trailer parked over there, and it blocks the corners. It's But and I don't know how the U-Haul guy gets away with it. He takes up parking spaces. He dumps tires. He's the worst. But let's get some 311 numbers and let's go after sanitation.
Yeah,
Okay,
because
Gio?
that seems to be because down here they could actually get the street sweeper underneath the overpass down by when I say down here, I'm pointing to Kingsland and Meeker, which is right behind me. But up until like McGinnis, there are no encampments yet. Knock on wood, right?
You're
But
lucky.
No, there's the guy right at McGinnis with the 12,000 tons of garbage.
well, yeah, but I'm saying like the gas station down here, right? From McGinnis, there's no the encampments go up. Down this way, there's nothing yet.
Right, but just west, just east. Now, just west of McGinnis is the guy with the 35,000 tons of garbage.
Yeah, that guy. But down by over here, they're not here yet. So before they start moving their encampments down here, they should get a couple DSNY trucks.
At the very butt end of the bridge, weren't they up against that wall over by?
Yeah, he hasn't been
McDonald's?
there. I think he moved down to the larger complex down there.
No, he's there. He has a tent on the right side of the highway before you go up the ramp.
Oh, I gotta
He-
take a
he-
see. I don't go.
yeah.
I haven't been.
He built a little platform for his tent, and he's got the tent there, so I guess the rats don't run in, and I mean, and all his crap is on the left side. It's disgusting.
good.
Yeah, he has a tent going. He's all by himself. He's still there.
And that auto store that's behind McDonald's, everybody does their car repairs in that parking lot, but also into the BQE.
Yeah, and that's where
And
some of the
then-
garbage comes from.
And then, of
'Cause-
course, that towing place next to the beer distributor, they have all their wrecked cars in that parking lot.
Yeah, it's
It's craziness over there.
But that's what happens when you let things get crazy for years. After years and years of warning that this is going to happen, it happened. It's here. Whatever. But that's it. That's my only concern.
Get me some 311s on where this stuff's being dumped, and let's go after sanitation, at least for some of those little, because I've seen the little piles.
Okay.
Okay.
All right?
Mm-hmm.
Right, Lisa? Hang in there.
Okay, no problem.
And Bozina,
Yes,
you're in
especially
charge of...
when you said these parts, when you have construction, that so many people can do that, but parts from the car, that is not so many people can do that. So it's probably very easy to catch them. And
Yeah.
they don't come from Bronx, it's probably somewhere from the neighborhood.
I have a feeling that it's the repair shops down here. At night, they get rid of their garbage and they just dump it over here. Because down here we have some auto repair. There's people actually
Which
running.
one?
I don't know what the name is, but it's by
No. Where is what's the location?
by the Staples up here. It's
Okay.
but you
By the
also
PFD.
have a
believe that's all
situation where you have people fixing cars underneath the BQE during the day. Like that's where they use their location to fix the cars. And then at the end of the day, their garbage, where do they put it? They leave it on the corner.
Yeah, they change their oil there and leave the old oil in bottles sitting on the ground there, which is a...
So the other day, the crossing guards were bagging the garbage and putting the garbage you know, because they can't cross kids, because that's how much there was vacuum cleaners on the corner of Kingsland and Meeker, right? Like it's, you know, there was vacuum cleaners, filters. So it's
All right.
that's all.
Call the 311, get
Yeah.
the 319 number, and then call it into the office, and we got to get that done.
Okay, perfect. Thank you.
All right.
Tom, you know where
right.
else they're dumping? They're dumping by Father Giorgio Post. You know, the little square there on Lorimer and Meeker.
Oh, the place where the sanitation workers were all taking a rest when they were doing the cleanup of the underneath the BQE the other
I
day.
guess so. So they have a
And they were
garbage.
they were resting right next to the garbage bags.
Yeah. So somebody keeps, I don't know. I mean, most of it is bags, but there's a lot of bags there.
Yeah, it's big black bags of stuff.
Yep.
And the sanitation guys just sat there next to it, didn't even try to move it.
Right. It's ridiculous.
I was like, oh, I don't see those bags. What bags? I don't see them. What? Yeah. 311 on that one too, Lisa.
Okay, I'll 311 it.
Yeah. No, definitely. We got to we have to get the numbers up.
Okay.
Got to get the complaint numbers up. Nobody calls them in. They don't go on the stats that go to the bullpen in City Hall for whoever's in charge to say, why are we getting all those 311s from that zone? Somebody go take care of it.
All right.
All right. Because that's how they operate, is by numbers. Bloomberg taught them all to go by numbers. Wherever you get the most numbers at 311, that's where we go. So you got to give them their numbers.
I just filed a 311 issue while we were on this call, so I'm getting those numbers up for us.
But record the
Thank you.
number and send it to the office so they can keep it on there. Because the way the report comes to the community board, it's aggregate for the community board. They don't say what specifically it is. It just says we have 35 noise complaints within board one, not where in board one.
Who do I send that to?
Just send it to the office. Marie or Joanna or whoever, they just keep track of them.
Okay.
Marie's going to kill me, but what can I tell you? No, but it's the only way. That's the way the city functions now. The police department have their comp stat. Poor Captain Faye has to deal with what her numbers are, even though the reality of what's going on in the street isn't always reflected in the numbers. So, and all the service agencies operate on numbers. So, give them numbers. Rosina, give them numbers on the cans along Manhattan Avenue. Geo, give us numbers for the things under the BQE. So, all right.
All right.
It's been a pleasure, everyone.
Thank you.
Go visit your restaurants. Everybody eat out.
Okay, so should I make a motion, Tom?
Visit.
Somebody needs to make a motion, yes.
So I would like to make the motion to close the meeting, please.
I'll second that.
Everybody in favor?
Yeah.
Aye.
Okay, good night, everyone.
Night, everyone.
Hey, Tom, thank you very much.
Nice to
Thank
hear
you. What was that? What did Maria say?
I said, welcome back to Marie.
Oh, yes. Marie. It's Marie.
Yes, I'm still here.
Maria
Thank
was saying
you.
welcome back.
Welcome back, Maria. Hello.
Thank you.
We will work on this. Okay. Good night, everybody.
Thank you, Tom. Thank you. Good night, everybody.